Good day. My name is Imelda Williams. This presentation will focus on the ankle and lower leg feedback. Please have your opinion form at hand so that you can self-mark as we go along. So for case 1, we have a patient, a dog ran into the left knee and lower leg, and there is now tenderness of the head of the fibula. So I'm just going to zoom in to the knee area, the area of concern. And one of the important things to do on the AP of the knee is to check that the condyles line up with each other. On the medial side it does. However, if we draw a line on the lateral side, we'll be able to notice that it doesn't line up. So there is a big part of the lateral condyle that doesn't line up with the femoral condyle, and that indicates that there is a compression fracture. And this fracture is, of course, of the tibial plateau. And I'm just going to zoom in a bit more here, so that you can see that there is a fracture line that runs across here into the tibial plateau. The femoral head seems fairly normal on this view, but of course we can't see the whole of the head, the head of the fibula. Apologies for that. And then on the lateral view, let's get this back to and let's just zoom in again to the knee area. So on the lateral view, very difficult to see the fracture that we have observed on the AP. That's why it's important that you scrutinize both of those images. But what we can see here is the soft tissue sign, where we have a lipohemothrosis just above the patella. So for this case then, the alignment is abnormal. We could see that on the AP view. The bone has a fracture. It's of course part of the knee joint, and then in the soft tissue there's lipohemothrosis. So all 4 of those, the ABCs, are abnormal. The overall opinion is that there is a displaced fracture of the lateral tibial plateau, and of course there is lipohemothrosis. Okay, for case 2, this is a patient who was admitted with a painful right ankle after falling off the skateboard. So I am first going to zoom into the AP view. So let's have a quick look at that. So it's quite apparent that the epiphyseal plates have not fused completely. However, what we can see is that there is a lucent line that seems as if it is below the epiphyseal plate. And then when we move across to the lateral view, we are able to see that there is a spiral fracture of the tibia, which is above the epiphyseal plate. So basically we are looking at a fracture appearance that could either be a Salter-Harris type 2, or it could be a Salter-Harris type 4, because that fracture line has gone through through the epiphyseal plate and is lower than the epiphyseal plate. Now, the report on this one was that the radiologist was unsure whether it is a true Salter-Harris type 4, and the patient was, of course, referred for a CT scan. So overall, in this case, you have a fracture of the bone. However, the joint space is not affected. And if we just come back to our normal view, we are able to see that there is quite a bit of soft tissue swelling here as well. So the overall comment then on this case is that there is a Salter-Harris type 2/type 4 fracture or injury, and then there's an undisplaced spiral fracture. The other thing that we can note is don't confuse this for an avulsion fracture, because that is the ostrigonum. Okay, so there's a number of images for this case. This patient kicked a wall and has come to the department with a left leg deformity. It's quite apparent on the AP view that there are multiple lucencies, which indicate that there is a comminuted fractures of the tibia. And I just want to get to the other AP view here. So we can see that the fracture lines doesn't go across the ankle joint itself. So it's above the ankle joint, so multiple comminuted fractures. It does seem as if the fibula is also affected, because there is a sclerotic appearance. So the ankle joint seems fairly intact. And then on the lateral view, I think the other view would probably be much better for this, but we can see that there is those fractures there. Let's just get this a little bit lighter. And then let's just zoom into this case. So we can see the multiple fractures of the distal part of the tibia, but then also the fracture of the fibula is visible on the lateral view. And once again, we have got, if you look at Kager's fact pad, it's displaced as well. So overall, the alignment is affected. It's mildly displaced here. The bone is affected and the soft tissue is affected. However, the joint is unaffected. So your overall opinion for this case is that there is a mildly displaced comminuted fracture of the tibia from the midshaft and distal part, and there is a fracture of the distal fibula. And moving on to case 4. And this is a patient, the clinical indications was that the patient is obese and has twisted the ankle. And once again, let's try and see if we can make this a little bit lighter. Yep, that's a little bit better. So we can see that there is a fracture of the medial malleolus, and also that there is a fracture of the distal fibula. And this fracture of the fibula has an angulation. The ankle joint, there is severe dislocation of the right ankle. You can see that the talus has been displaced laterally. And now let's just have a look at our other views as well. So on the lateral view, it doesn't show us much more. We can see the soft tissue swelling. Here is a calcaneal spur. There are some chronic changes as well. So overall for this case, and I'll just refer back to our AP view, the alignment has been affected, the bone has been affected, the joint is affected, as well as the soft tissue. So your overall comment here should be that there is extensive fracture dislocation of the right ankle, and there is an oblique fracture to the shaft of the fibula with some angulation, and there's a transverse fracture of the medial malleolus. Our final case is a patient who jumped from a ladder and now has a swollen ankle. Okay, so for the AP view, the lateral view is the most important one here. Just an incidental finding on the APs and ossifying fibrosis, which is a normal variant. So on the lateral view, and I'm just going to zoom into that one. It's quite clear that there are a number of lucencies, so there are comminuted fractures of the calcaneus, and the fractures also go into the subtalar space. And if we want to, we can measure bolus angle, and I'm quite sure it will be quite compromised in this case. So drawing the first line, and then the second line, and it gives us a measurement of about, I think it's about 18 degrees, so a very compressed fracture of the calcaneal plateau. And then let's just go to the axial view. The axial view just shows us more of the fracture of the calcaneus. So overall, the alignment has been affected, the joint has been affected, the bone is affected, the soft tissue, there's quite a lot of soft tissue swelling here. So your overall comment should be that there is a comminuted intra-articular displaced fracture of the left calcaneum with involvement of the subtalar surface. Okay, so that's the end of the cases that I've given you. If you have any questions, please feel free to contact me. Thank you.